we have a lot of amazing speakers who are sharing their time and expertise, and we want to honor them by sharing all of your beautiful faces as our guests. There's nothing more discouraging, really, for speakers than looking to a blank screen. Would you agree? So we really want to encourage that. Also, there is a chat function that's available. So thank you so much. I see people populating it right now. Please drop in your introduction, your pronoun, your preferred pronoun, or perhaps your medical student, your year in, and as well as your profession. We'll do our best to capture your question and ask them as they go. In fact, let's test it right now, like we're doing. Drop in a greeting. Maybe perhaps we have a lot of people here from different parts of the world. Uh, Maybe how you say hello in your country. I'll start. I'm from the Philippines. We say kamusta, and maybe some folks want to just drop it in there as well. Different greetings from your country. Awesome. The Youth Global Health Innovation Conference is an annual event organized by medical students at the University of Washington School of Medicine in Seattle. It's also in partnership with the University of Washington School of Global Health and Bioengineering. It's exciting to hear this morning as medical students introduce themselves and their journey with schooling. So today's conference is really going to be cutting edge, and I'm really excited to be part of this. Today's conference focuses on emerging technologies and medical innovations in solving today's global health issues. It also provides an opportunity for students and professionals in their fields to connect with other folks on the other side of the community or the world. So the conference is not only unique, but important because of all the actions that you all are participating right now. I hope what you experience today is not just, oh, that's an interesting kind of moment, but we hope to encourage you that you have an aha moment where you can say that's awesome and you're learning new things with each other. If you happen to find yourself feeling curious, intrigued, or even challenged, please lean in to find your answers. This conference could have been pre-recorded and shared, but this is an innovation conference, so it requires feedback and input from you. And one last request, please take one positive social risk and connect with each other, perhaps someone you did not know before. There are a lot of new people you'll meet today and learn together. So let's get started. So now I have the distinct honor introducing to you an amazing, talented, and brilliant and passionate young person who's already making an impact in our community here in Bellevue and beyond. I'd like to call Mayor Gruwal to share with us today's agenda, the conference format, and other important details. Mayor?
Thank you so much, Patrick, for that very kind introduction, and so inspiring and so invigorating to kick us off today. Just a little bit about myself. I am a student at Interlake High School here in Bellevue, Washington. I'm a rising junior, and I'm the founder and director of Worth a Shot, and we're a global nonprofit organization dedicated to bridging healthcare disparities worldwide. And I'm also the founder of the Youth Global Health and Innovation Conference. So I also want to, before we get started, I want to take a minute to acknowledge our amazing medical students and volunteers, and I'll hand it over to them in just a minute to introduce themselves. And I'm so excited to acknowledge Brian, Shelby, Rinchoji, Patrick, Ajuni, Louise, Akanksha, and Rutej. So if you guys could all take a minute to introduce yourselves.
Hello, everyone. Oh, you can go.
Hi. Yeah, you go. You can go first.
Thank you. Thank you. Hello, everyone. I'm Louise. I'm an undergraduate student, rising freshman at Seattle University. I'm part of the Worth a Shot team. I plan to pursue medical school, and I'm interested in public and mental health. Thank you. Thank you.
Hi, everyone. I'm Akanksha. I'm a medical graduate, and I'm a current residency applicant, and I'm looking forward to this meeting. Nice to meet you all.
Hi, everyone. My name is Brian. I use he, him pronouns. I'm a third-year medical student at the University of Washington School of Medicine. It's wonderful to meet you all.
Hello, everyone. My name is Ranjit Singh, and I'm a medical graduate and a residency candidate for this year. And I'm honored to be part of this conference, and it is nice to meet you all. Thank you.
Hi, everyone. My name is Nevin Califf. I'm a second-year medical student at the UW School of Medicine. I'm also very excited to be at this conference and to meet you all today.
Hi, everyone. My name is Patrick. I'm also a second-year medical student at the University of Washington, and it's my great honor to be here as well. It's really nice to meet everyone.
My name is Junior Denoa. I'm a freshman in high school, and I'm also part of the Worth the Shop team, and I'm very excited to be in this meeting with all of you. Nice meeting you.
Thank you so much, everyone. So I would now like.
Can I go? Sorry, can I go real quick? I think.
Okay, sorry, go ahead.
Yep. Hi, my name is Raftesh Tandi. I'm also a medical graduate, and I'm a possible applicant this year for residency, and I'm happy to join you guys today.
Thank you. I think everyone's gone now. Okay, so I would now like to introduce our first speaker, and I would like to. I'd like to say that I would like to first say that today we're going to have an amazing day, exciting day packed with fun. You're going to hear from speakers around the world who are experts in their respective fields, and you'll be able to ask them questions during our Q&A for the last 5 minutes. So now I'd like to hand it over to our first speaker, Dr. Farquhar. Dr. Farquhar is the chair of the Global Health Department at the University of Washington, and she's a professor of global health, epidemiology, and infectious disease. And she will be talking to us today about her amazing work surrounding strengthening healthcare infrastructure in developing countries and lessons learned from working in global health. So we're so honored to have her here with us today. Thank you so much for your time, Dr. Farquhar.
Yeah, thank you. Let me just share my screen. I can't see you. Can you see my screen, or is it not?
Not yet.
Not yet. Okay. Classic challenges here. Just a moment. Not quite sure why that would be. Let's do this. Here we go.
Okay, yes, now we can see it.
Okay, let me just put it into this mode. All right. So first, let me just thank the organizers and Mara in particular for inviting me back. I was able to participate last year, and I just can't say enough good things about this conference. One of the really unique aspects, which I think is probably obvious to all of you, but I think it needs to be stated, is that this is a conference that's put on by young people, by you, the youth, those individuals, you who are going to be potentially really affected by the global health problems that will be coming down the pike in the next number of decades. And you're on the front line now, right? It's your careers that are going to be the ones that have an opportunity to make changes and really, steer, the course in a positive way. So congratulations to all of you who've pulled this together. And I guess it's not unprecedented since you did it last year, but I think it's pretty special and unique. So well done. I'm going to talk about global health sort of broadly, since this is kicking off and opening the conference for all of you, which it will be a truly amazing day. And then I'm going to talk also about some specific examples of how at the University of Washington, we've had the opportunity to build capacity for research and also for clinical medicine in our collaborating, with collaborating partners in the places where we've been working. So I'm going to talk a bit about what is global health, why work in global health, and really how should we be doing global health work, and then hopefully give some sort of illustrative examples, and would very much welcome questions at the end of that. I'm, as Mayor said, I'm an infectious disease doctor. I trained in internal medicine, infectious diseases for all of you residency programs. And then I did a master's in public health. I love clinical medicine, but I also feel like my heart very much is in global health. So what is global health, and what isn't it? I mean, global health it's a combination of public health, and as well as clinical medicine, healthcare, health systems, policy, it's practice. It's just much, much more than medicine, because the problems are incredibly large, expansive. They cross borders, and generally require very interdisciplinary approaches, which I think is what's exciting about this conference too, is you're talking about innovations. And to be innovative, you absolutely need to be getting perspectives from a number of different angles. So it requires an interdisciplinary and very inclusive teamwork approach. Constantly, one needs to be thinking about sustainability and resources, because you can't be kind of jumping in and providing these super innovative ways to approach a situation that aren't feasible in a setting or sustainable. And the best way to do that is with partnerships. Partnerships are essential. However, partnerships are often quite inequitable because of the power balance and frankly, the resource balance, the funding, and just the capacity some people in some parts of the world have to do things that others might not, like travel. I'm excited too for you, because there are problems that are enormous and weren't even on my radar when, not just because it was me, but because 30 years ago when I was thinking about this as an undergrad doing international relations and my pre-med work and then going through medical school, we weren't really thinking about some of the really large problems that you will be having an opportunity to address and certainly having to grapple with. One of these is climate change. So I'm going to just spend a minute talking about climate change. And this is a slide that I borrowed and absolutely love, because it shows in the center that turning dial what's happening with climate change and how each of these aspects, the extreme weather, the rising temperatures, increasing CO2 levels, rising sea levels, has a direct effect on the environment, whether it's changes in vector ecology or changing in water and food supplies, and how that then affects health. So this slide, I think, very much demonstrates the complexity of global health. One can't just go in at the outer edge and say, okay, we're going to try to talk about malnutrition without actually looking at some of the more core determinants of the problem. The other really rising concern is non-communicable diseases. Global health, rightly so, for many, many decades has focused on infectious diseases, because infectious diseases historically have caused the majority of death and disability. We often look at health problems with respect to the amount of disability adjusted life years. How many years is a health condition taking off someone's life and not allowing them to be productive members of society? And what we see in this table here is that with years on the x-axis there from 1990 to 2017, we've seen a pretty dramatic decrease in the number of DALYs attributable to communicable maternal, neonatal, and nutritional diseases. So that's wonderful, as we've had increases in access to safe and clean water and healthcare. But the non-communicable diseases in purple have been steadily increasing. And in fact, if you really look at the leading causes of death and disability, cardiovascular diseases has now risen to the top. And maternal neonatal is still incredibly important. Infectious diseases like TB and HIV still important. But what we're seeing with changes in lifestyle, having potentially more sedentary and more urban lifestyles, that we need to be focusing on cardiometabolic diseases and many of the risk factors that contribute to those. So that's kind of the what is global health, and I'm happy to talk more about that afterwards. Why do we work in global health? I think there are many reasons, and this is in a way a lot easier for one to get their head around, certainly for me. Global health it's fascinating. They're really large, important, intriguing problems that are in need of solutions. And we all have an opportunity to have an impact, to make a difference. It's quite very gratifying to be able to interact with people from other cultures and to really appreciate other ways of doing things. And clearly there's some adventure and excitement to traveling and meeting new people and being in new environments. I want to stress that this is true for all of us working in global health. It's not a global north phenomenon. The global south, individuals who are doing research and programs and are just as eager to travel and see and do new things, have experiences in other parts of the world. And I think that's one thing we have to be really cognizant of, is that these types of experiences need to be equitable and there need to be exchanges. So if you are currently a student at University of Washington or a medical graduate, always be thinking of having your experience replicated for somebody else, and how can you make sure, if you're a part of a program, that is integral in that. Now, importantly too, I think we need to be paying a ton of attention as to how we do global health work. And I was just alluding to that when I was saying that there has to be a bilateral exchange, when we're doing work in other places. People from the communities where we're working or from those countries also need to have opportunities in other places, whether it's the global south or the global north. South-south, north-south partnerships are key. Those partnerships are not always equitable, and one thing we are really working hard on within the Department of Global Health, where I'm currently the interim chair, is how do we sort of shift the dialogue so it's not so much us getting feedback from leaders in the global north about how things should be done in the global south, or even leaders in the global south as to how things should be done there, but how do we truly interact with our partners, those individuals and groups who are affected by these problems and know best really how to answer them. So one thing we're doing is we're shifting from having an external advisory board made up of very illustrious individuals in global health, which was wonderful, I think quite important as we were building our department. But now 13 years in, we're saying, okay, now we have all these programs, but we need to have change the way we are implementing them so that it's truly equitable. And do a better job at that. I think we've always been trying. So we're establishing a partnership advisory board where we're bringing individuals from our partner organizations and institutions and asking them, is this working for you? Is the funding, when it comes to us, is it actually making its way to you, or is it better for the funding to go to you, and asking tough questions that way. This article by David Citron, who's at University of Washington, and did some really nice work on partnerships in Nepal, is it good to look at if you're able to access that. So we want to be doing our global health work alongside community members and colleagues from the Global South. We need to be doing a lot of listening. We need to be very patient. Things won't go as quickly if you're doing them alongside community members and really listening. It's much easier to go alone than to go together. I would say easier. It's less sustainable. It's faster, but it's not as effective. And we have to have a lot of humility in doing that. So that's the kind of what, why, how. I now am going to shift and provide a few examples from my time at University of Washington and my work in Kenya, I have sort of elected to focus my efforts and my collaborative research and clinical work and public health practice work in one place. And I think that the reason for that is that if you're truly going to make a difference, you need to concentrate efforts. We at the University of Washington have also, I think, been fairly concentrated in our efforts in Kenya and have been working there for the last 30 years. One really unique aspect, and I think what made an enormous difference in the success of our collaborative work in Kenya has been that right from the get-go, back in the late 1980s, and I was not around at this time, but this predated me, the leads of projects in Kenya had the foresight to apply for funding to get training from the National Institutes of Health in the US to support Kenyans who were emerging and often even more experienced scientists and researchers to come to the University of Washington and train. So we've had more than 70 Kenyans earn their master's in public health degrees, actually masters in epidemiology and biostatistics as well, and increasingly also doctoral degrees, PhDs in epidemiology and also in implementation science, which is a field that focuses on how do you optimize the delivery of interventions that we know work. Let's say we know it works to provide a nutritional supplement to children who are malnourished, but how do we actually effectively reach those children and deliver that? What's been interesting for me, I've led this program since 2001, and I've been fortunate to see it evolve, I think in a very positive way. We've evolved from training individuals, kind of a smattering of individuals across multiple countries, to training groups of individuals within an institution or within a cluster of institutions to build institutional capacity so that when someone earns their PhD, they actually have other colleagues to work with and they can collaborate, and then they also can then train that next generation within, say, University of Nairobi or within the Kenya Medical Research Institute or Maseno University. We've also seen a shift from focusing on academics and training researchers who are based at academic institutions to training individuals who might be in ministries of health and who have an opportunity to conduct research that's very applied and that can change practice and policy because they are embedded in that system. We're constantly working on shifting training based in Seattle to training in Nairobi, training in Western Kenya. We now have a combination of training opportunities in both places because ultimately we would like to be able to provide the highest quality training in a place where they don't have to travel and be away from their family, and it's also much more cost effective. But we want people to have the the highest quality, so it's taken some time to build the programs there and actually train individuals with doctoral degrees in epidemiology from University of Washington to then go back and teach in programs there. This last year, we also were successful in shifting the funding of the largest grant we have from being directly to the University of Washington and to me as the principal investigator to our Kenyan colleague at the University of Nairobi. Actually, he's at Kenyatta National Hospital. One of the most important parts, I would say, of decolonizing global health is having the funding go directly to those countries and those institutions in the global south so that they have the control of the funding. So it takes a lot of kind of collaboration and work and patience, as I said, but it's incredibly gratifying. And ultimately, the product, I would say, is much better when you are having that program led in country. And the result is that our graduates are really doing a phenomenal job. On the left here is Dr. Beatrice Wamuti. She earned her MPH and PhD in implementation science with us. She's really passionate about how to scale up programs to prevent and treat people living with HIV. She's now at Harvard doing a postdoctoral fellowship. She's also, very interesting. I think this fellowship is focused on cost, which is something that I think we don't think enough about, but cost is absolutely critical. Because if you have to scale up a program, the Ministry of Health and those who are going to be taking it on need to know how much it costs and need to budget accordingly. And then on the right, we have our Vice Provost from the University of Washington. They're visiting, and I'm sharing this picture because Dr. Knuthia, who's to the right of Dr. Riedinger, is now leading the research programs there. And he and Dr. Nwani, who's second from the left, have been really pivotal in a few other programs that we've been able to do with University of Nairobi and Kenyatta National Hospital that have been focused on research, but also on building capacity around medical education. I think there are opportunities for innovation in all different realms, and I would encourage you during this conference to not only think about how you can directly improve health with innovations, but how can you change medical education? How do we teach what we teach? With Dr. Knuthia, with Dr. Nwani, a program that we were able to establish in Naivasha, Kenya. It's this one called the Clinical Medical Education Partnership Initiative. It was based on a program that was trying to improve education for individuals in medical training, but also doing dentistry and social work and nursing. And it involved multiple different institutions. And one of the sort of innovations that program took on was to borrow what we do at University of Washington with our decentralized model of medical education, in that currently at University of Nairobi, everyone trains in the city and then doesn't have the experience in rural hospitals that would enable them to make a kind of a career shift and say, okay, I'm going to go work in this more remote part of the country. We have something similar at University of Washington, where training may be in Seattle or in Spokane, but students do rotations all over a much larger area, including in Alaska and Montana and Wyoming. So through this, we established a partnership with the Naivasha District Hospital. And this building that you see there is not the hospital, it's a simulation and resource center that was funded with donations from a number of individuals around University of Washington when Bill Bremner retired. And as you can see in these photos, we have people like Dr. Carey, who's an obstetrician gynecologist, doing a simulation around childbirth, some neonatal work. We have a chief resident in Naivasha, Kenya, which I'd say is another big innovation. One thing you don't want to do is have students or residents going to a place that doesn't have the human resources sort of on the ground to accommodate them and make sure that they are integrating and able to do the teaching that they were sent there to do. So we have a chief resident who's based there permanently. Up on the right side here, Dr. Josh Laxina is doing an ultrasound, it looks like, to identify if there's pleural effusion. And he was living there for a year and ensuring that when we had residents or students coming over to Naivasha, they could seamlessly enter the system and interact in a positive way with interns, medical officers, and our Kenyan colleagues. So, hopefully these have been some good examples of the way programs have worked. I wanted to end with what I see as kind of one of the success stories. This photo is from about a year ago when we had a large conference to look at some of the results from one of our research projects. And, we pulled together people from the Ministry of Health, from our National AIDS STD Control Program in Kenya, a few of us from University of Washington, many from PATH Kenya, which was our partner in doing the work we did. And what you can see in this picture, which is very different from, if you recall, the very first picture, which I said, this is UW in Kenya. These are the people on the ground who are truly going to be making a difference. And if together we can do research projects and then come into a forum where we call brainstorm, it's like, okay, now we've got these results, what's the next step? And people have been trained in a way that they're able to then take the steps necessary to move things forward. I think we're in a really good place. So hopefully, we're sort of going from a three-legged stool where we're doing research and training and providing clinical services to building capacity, training the next leaders in practice, policy, and research, continuing to have these healthy interdisciplinary collaborations, and ultimately having those communities truly own their programs and the research they're doing. So that's my goal, and I'd be happy to answer any questions from any of you on that. Thank you so much for giving me this opportunity.
Thank you so much, Dr. Farquhar. This was such an amazing and inspiring message, and so pertinent and so good for young people to know about the limitless possibilities there are in global health.